After surgery, it's very important to follow the detailed activity kind of program that we give. Often for a knee or shoulder or elbow, there's just some activity restrictions and a brace or a sling or crutches, etc., assistive devices that you need to use to protect your surgically repaired joint. Typically we'll give a detailed set of instructions and in addition a detailed physical therapy protocol when the timing is right to initiate therapy. If there are questions, often the regional nerve block is a source of questions. Typically there's a number you can reach the anesthesiologist on call to talk to about the nerve block. If there's also questions, then my clinical athletic trainer typically is available, or you can reach us in the office, and there's always somebody available to answer those. There will be a team approach afterwards too, where in addition to me, my team will help guide you through the early post-operative and rehabilitation process. So we'll try to make it as seamless and easy as possible.